I spent about a year in the hospital with various complications from steroids that I take for asthma. So I was left quite weak. Then in August of 1994, my right hip broke and I needed a total right hip replacement. Following surgery, my entire leg was paralyzed, which fortunately most of that has returned, but I was still left walking with a very stiff wooden gait, and every step I took was extremely painful. In addition to that, I had a compression fracture in my lower back and a lot of back weakness, which created additional pain with every step that I took. I could probably sit up for about an hour and a half, but I needed pretty strong pain medications even to go to the movie theater and do anything. Walking was limited to what I call one-stop shopping, and that was about the extent of how far I could walk. And that was also using crutches. Anything longer than that, I needed to use a wheelchair. After I had the hip replacement, I went to an inpatient rehabilitation program for about 3 weeks, and of course went through the traditional physical therapy. I was still very limited in the range of motion in my hip and still needed at least one crutch for short distances and 2 crutches to go any length of walking distance. I had the first neuromuscular therapy treatment in January of this year, and even after that very first treatment, I noticed that I could move quite a bit more freely for at least 2.5 or 3 hours, and the pain was significantly diminished. After my 6th treatment, I was able to throw away the crutches and walk on my own 2 feet again. The wheelchair is a thing of the past. Well, as a rehabilitation nurse, of course, you're kind of used to the traditional paradigm and traditional treatment, and so I have to admit I kind of looked at him like, what are you talking about? I thought, you know, I've been through rehabilitation programs and physical therapy, and you know, what's this new stuff? Is this just something that's kind of a crazy quack treatment, or is it something that maybe will work? And he started explaining a little bit about the neuromuscular therapy, that, you know, his idea was that myofascial tightness caused pain and discomfort and led to dysfunction. As a patient, I'm learning why individuals keep looking for more and more of an answer when they don't get the results that they want from traditional treatment. I have severe asthma, and after I'd been coming here for a while, I guess it was probably about after 15 treatments, I had what I call a bad asthma day. I'd started wheezing about 3 in the morning and really thought I was going to have to double my steroids in order to stop the wheezing and be able to breathe. And when I came in, I felt like I had Dumbo the elephant sitting on my chest, and no one could even understand what I was saying because I couldn't speak above a tiny, tiny whisper. And Kenny Owens said, well, I can help you with that. And I thought, right, what is he going to do for an asthma episode? But I figured, well, it's certainly better than taking steroids. And sure enough, he went to work, and within 4 minutes, had me talking and laughing again. I mean, it was truly amazing. I feel like I found my magic wand when I found Delos neuromuscular therapy treatment. One of the things that really surprised me was just how much knowledge Kenny has about pain. I mean, somebody who hasn't had a medical background, and he completely understands where the pain is coming from and how to treat it and how to get rid of it, instead of just teaching us how to live with it. I think that Delos neuromuscular therapy treatment could also be very effective for dentists to know about. I experienced TMJ several years ago and went through 4 surgeries in order to get any relief, because the tightness of my muscles had pushed the TMJ disc out of its joint, and my jaw was locked shut at 13 millimeters. And I think that rather than having all those painful, expensive surgeries, perhaps Delos neuromuscular therapy treatment would have worked. In terms of looking at healthcare reform issues, we're looking at cost effectiveness, outcomes, and preventive care. So certainly Delos neuromuscular therapy hits all of those three targets. It's very cost effective, the outcomes are positive in terms of reducing pain, eliminating pain, and improving quality of life, and we can prevent further dysfunction and disability later on in life. I think if the insurance companies look at the outcomes of what they're getting for their money, they certainly can't go wrong choosing Delos neuromuscular therapy.